Okay, good morning and warm welcome to all participants of the webinar. I'm honored and delighted to have the opportunity to share my knowledge and experience in the field of prosthodontics and implantology with you. My name is Aleksander Malinowski. This is my photo from Seoul from yesterday. I came from the Lower Silesia province in Poland. It's a great pleasure to speak before such a distinguished audience. Let's see the castle from my regions. They are beautiful. Come visit to Poland. Okay, we will talk about the facial scanner. Today's presentation will focus on application of the RayScan facial scanner in our field. I hope that today's session will be both informative and inspiring to you. My presentation will be divided into two main parts. In the first one, I will focus on the basic aesthetic criteria that are foundation of my actions in dental prosthodontics. Aesthetic is extremely important in my work as it affects not only in final appearance of patient's smile but also in their well-being and self-confidence. In the second part, I will talk about the application of the facial scanner in prosthetic practice. I will focus on specific prosthetic cases, each illustrating the different advantage of this advanced tool. Discussing real clinical situations will provide a better understanding of how the RayFal facial scanner can revolutionize our approach of treatment planning. Okay, so let's start. Let's focus about parallelism of the facial reference lines. The midline should align with the inter-incisal line and the central papilla, and this is the most important line for us. The second one is the papillary line, which should be parallel to the line connecting the mouth corners and the cusp of the canines. And also, it should be parallel to any line drawn through the cusp of the corresponding pair of teeth. In this slide, we will discuss the long axis of the tooth. Observe how the axis extends from the apex of the root to the center of the incisal edge, forming an angle relative to facial midline. The next slide shows us the gingival zenith contour. Let's now focus on the gingival zenith contour. The line connecting the zenith to the crown center typically exhibits the eccentric position to tooth long axis. So here you can see the tooth axis and the zenith contour line. It's a little bit eccentric except the lateral incisor. Let's talk about balance of the gingival margin contour. The clue is the fact that the lateral incisor should be little bit shorter than the central incisor and the canine. And the height of the gingival zenith should be symmetrical on the both sides of the smile. It's really important, especially when you plan the surgical correction of the gums. The uniform height in this area will create the impression of overly large teeth. So we should remember about the zenith and the balance of gingival margin, because when we forget about it, we would create too large teeth. Okay. Position of the incisal edges of the upper teeth in relation to the lower teeth. So the lateral incisor should be in the distance of 1.5 to 1.5 millimeters from the lower lip. Central incisors should be in closer relations than the lateral incisors. But what is also important, we should remember that teeth should not touch the lower lip because it will be unfunctional and probably it will be not accepted by the patients because it looks like the teeth are too large. So as we all know, the patient who should have interdental papilla is related to the contact points of the teeth. But if we cannot make the good condition in that case, we should make the surgical elevation of papilla, or it can be compensated by hyaluronic acid injection. I like to use that. Talking about state of tissue health, you can read about this on the left, but this is particularly important when we planning prosthesis or other work using the gingival mask. We should remember about changing colors on the different levels of the mask. We must remember that the color of porcelain or the acrylic should not be uniform. Discussing the proportion and dimension of anterior teeth, we usually read about the golden ratio, but Princeton research showed that the ratio of the width of the central incisor to the lateral incisor corresponding to the golden ratio is occurred in only 70% cases. Moreover, the width of the lateral incisor in relation to the canine was observed in 0% of the cases. It's highlighting the impracticality of the golden ratio in smile aesthetic. Applying this ratio could lead to unnatural narrowing of the jaw. It's important that the approach to design a smile is more individualized and tailored to the overall facial aesthetics, rather than based on mathematical rule. However, I think that it's possible that mathematical rule proportion exist to describe the ideal smile. We just haven't discovered them yet. Let's talk about some magic. We should know that larger teeth appear wider despite having the same width. So this teeth looks a little bit wider than this one, but the difference is only in the length. Lighter teeth seem larger and more protruding compared to the darker teeth. So it's significant for large canines where the perception of the size and positioning can greatly affect the overall appearance of the smile. So when we have big canines, we should consider to make them a little bit darker. When we are forced to make big canines due to occlusal factors, for example, we should consider make them darker. Let's analyze the interincisal angles. An acute angle should be present between the central incisors, adding dynamism and character to the smile. Meanwhile, the angle between the central and lateral incisors should be obvious, allowing for smooth transition and maintaining proportion within the dental arch. Rounded incisal angles compensate for the teeth that may appear too large, softening their look. Conversely, in, for example, periodontological cases, sharp angles can be used to mask teeth that are too narrow, visually broadening them. Let's talk about the difference between a positive, negative, and flat smile line. The positive smile line is characterized by the incisal edges of the upper teeth being visible above the lower lip, creating an arch that mimics the curvature of the lower lip when smiling. This is perceived as youthful and vibrant. The negative smile line occurs when the incisal edges of the upper teeth are less visible or not visible at all below the lower lip, which can give the impression of older age and tiredness and sadness. The flat smile line is when incisal edges of the upper teeth are parallel to the lower lip, without visible curvature. This can make smile seem less dynamic and also sad. In younger individuals, we can consider to make the gull-wing smile line. It's characterized by the incisal edges of the central incisor being distinctly longer than those of the central incisors, creating the gentle curvature that resembles the wings of the gull. This shape adds a youthful and dynamic character to the smile. In older ones, we should consider another shapes. Let's talk something about facial scanner and articulator. AI of the software autonomously identifies anthropometric points of the face and conventional orientation lines such as the middle line, the Frankfurt plate, camber planes, the trigon points. Let's see how many points on ear AI can recognize. This allows us to position the articulator in arbitrarily hinge axes, which allow us to work with articulator, but without the face bow.